Hey, I'm And.
And I'm Beck.
And we are the Gold Diggers, because we believe there's gold found in everyone.
Everyone is unique, interesting and exciting with a great story to share.
And we aim to find it.
The question is, can we rise to the challenge and strike gold? Stay tuned to find out as we chat to today's mystery guest.
Honey, you're my sugar.
So this is how it works. One of us knows who the mystery guest is and the other one doesn't. And today it's Angela's turn to find the gold in our mystery guest, Dr. Colin DICKS. Welcome to the show, Colin.
Thank you very much. Real pleasure to be here.
Hi, Colin. It's good to meet you.
Yeah, likewise. Yeah, lots of digging to go on, I think.
Yes, definitely.
Yes.
We're going to be digging for some gold.
Yes. So, Angela, I'm going to give you just a couple of things about Dr. Colin.
Yeah.
And first of all, he's a doctor.
Well, I kind of figured that. I knew you were going to say that.
Did you?
And
It's
the
like
fact
doctor
that,
isn't his name, it's his title.
and the fact that you brought a whole bunch of donuts in this morning
I did
would
bring donuts.
say he's not a gastroenterologist.
No. In fact, one point is he really likes donuts.
Oh, okay.
Yes.
Right, okay.
And,
That's what you're giving me.
Oh, he's married and has 4 children.
Wow.
Yes.
Busy
So a
man.
doctor who likes donuts and is married with 4 children.
Okay. Wonderful. All right. You sending me out the room?
Yes, I'm
Okay,
sending
I'll
you
see you
out of the
soon.
room. Off you go, young lady.
Honey, you're my sugar.
So, Colin, now that Angela's out of the
Yeah,
room,
now we can gossip.
that's
right.
right. We're going to talk to our listeners about who you are.
Yeah.
And Angela's going to dig that gold out of you. So, first of all, just in case anyone doesn't know, I run a business called Star Label Publishing and we publish books. And we just happened to publish your book recently. And your book is Death, Dying and Donuts.
Look, it's been a fantastic journey working with you and getting the book published. As you know, it's lots of backwards and forwards and hard work, but it's been a real pleasure getting this book out. The death and dying part is the difficult part, but the donuts is the part that we get to enjoy.
Yeah.
Life, yeah.
Yeah, and I love the book. I love, actually, we had a reader's response recently and they said, I can't believe I just enjoyed a book about dying.
Yeah, that's incredible.
It's
That's
an
the whole.
enjoyable dying book. Like,
Yeah.
amazing.
How crazy is that?
So just a little bit about your background. So you were born in South Africa and you had a lot of experiences confronted with death from an early age, didn't you?
I did. It's been, I guess that's where the interest was piqued. I was still at high school when I saw the first person die. I've seen 2 motor vehicle accidents with people died as the first person at the response there. As a doctor, you get to see a lot of death, but one of the things that intrigued me was what happens at that real moment of death. What's happening when your body's not working anymore? Is there soul? Is there spirit? When's that moment when life ends and is extinguished irreversibly? And I think the interest was there, just lots of exposure to death where people now would get counselling for it and say it was terrible.
Yeah.
But it was, in some ways, fascinating to see this end of a physical body and what went on there.
So your life has then stemmed from those experiences and you've gone on to study even palliative care and everything to bring you to a point now where you're writing about death and helping those who are diagnosed with terminal illnesses. And the gold that I see in you, Colin, is that you have this great empathy for people and you've taken your job beyond the call of duty, so to say. You've gone and researched deeper into this topic so that you can help educate people in their last days of life how to live those days out the best that they can. And I think that's just a magnificent thing that you've invested your life into to help people during the most difficult times of their life and also for their carers. So we'll get Angela back in and we'll get her to dig some gold out of you and find your story.
Yeah.
Honey, you're my sugar.
Welcome back,
Thanks.
Angela.
I left here
Yes.
feeling like $1 million.
Yeah.
Because you said to me, goodbye, young one.
Goodbye, young lady.
Young lady. I was thinking, been a long time since I've been referred to as a young lady. And I'm older than you.
I must be really young then. If you're a young lady.
So thank you, Beck. I feel like,
Pleasure,
I'm walking on a
Angela.
cloud now.
Always trying to lift people up.
Lift up my spirits. Well, you've done just that.
Awesome.
So, Colin,
Yeah.
nice to meet you.
Likewise, absolutely.
I'm interested in how you got the doctor. But before we go there, before we go into your professional career, a man that's obviously built a career with 4 children, what has that been like for you?
Look, I picked the most arduous and difficult career to get away from the children, because if you have 4 young children at home, it's a lot of hard work. No,
And a very tolerant wife.
a fantastic wife, amazing wife.
Yeah.
So, you start with number 1 and not sure where you're going, and then 2 and 3 arrives, and then the 4th one is a bit of a miracle child in the sense that we weren't sure we wanted a 4th one, but we had such direction about getting a 4th child, his name, and divine intervention in a sense. So it was great. We stopped at 4, but it's been amazing. Being a father, having 4 kids, it's busy, and people ask, what are your hobbies? You don't have time for hobbies.
That's
when you have
true.
4 children. You're busy all the time.
Are they still at home?
They sort of in their 20s now. So I've got one in the Navy, a daughter doing marketing, a daughter doing physiotherapy, and a son who's an accountant.
Wow.
In Brisbane and Canberra, and one at home.
So still a full life for you then?
Flat out. Absolutely. Yeah.
Okay, so moving then into your professional career, you were a doctor of what exactly?
I'm a medical doctor, trained in radiation oncology, so I finished my medical training. After that, went up to the United Kingdom for a year, worked in Hull for a year in the oncology department, and really enjoyed working with cancer patients.
Yeah.
Came back to South Africa, specialised in general medicine for about 2 years, and then thought, no, this is way too much, it's hard work, and went down to the radiation department and fell in love with the equipment, the technology. Back in those days, we were using cobalt therapy to treat cancers, and it was just extraordinary, this invisible beam of light that cures cancer.
Wow.
Just, I've always been fascinated. Still been doing this job for more than 20 years. It still amazes me. It's like...
So you've watched the progression of technology then as well?
I have, very much. Yeah.
So you said South Africa. Are you originally from?
I am.
South
born
Africa.
in South Africa,
I was going to say, I
Yeah.
could detect that in your
Yeah.
accent. So how long were you in South Africa for?
So till our mid-30s, then went to New Zealand for 2 years for an adventure to go and see what happens at the other end of the world. Stayed 5.
Yeah.
And then we moved back to South Africa to be with our parents and live there, and we lasted 9 months.
Wow.
I got a job on the Sunshine Coast, and we haven't looked back. It's been,
I
this
can
is
see why.
paradise. This is an amazing place to live.
And you were doing the oncology all that whole time as well?
I have, yes. So my specialty is radiation oncology, and I've been working with cancer. And as part of the cancer journey, you're talking about death. You still have to have this conversation. And one of the things I found early was that nobody has these conversations. We as doctors talk about treatments, we talk about the next line of treatment, we talk about anything, but the elephant in the room is death.
Yeah.
I think the thing that made me, startled me the most, I had a patient, we call him Tom, and he was in his 20s, he had terminal lymphoma. He was about 2 weeks out of his death, and he was just not prepared. He had done no preparation, hadn't done any work for it. And I said to him, Tom, you realize that you are dying. You realize that in your life you got weeks, you got days or weeks to live. And he was furious. He was absolutely furious that I'd brought this conversation up and I'd spoken to him about death and dying. And it made me go back and said, when do we have these conversations? How do we address the enormous elephant in the room? It's there, everyone sees it, but nobody talks about it. How do we go along and change that? And one of the tricky things is, when's the best time? It's not when people are dying. It's not a month before they're dying. It should be a school subject. It might be something that's best taught in year 12, that we mortal, that we have a shelf life, and I guess that's part of the book. Yeah.
So you've written a book about this.
Yeah.
And it's called?
Death, Dying and Donuts. I had to think about that for a second, yeah.
It's the donuts bit on the end.
It is. That's what makes it enjoyable, yeah.
So death and dying, I can understand. What is the donuts part of you?
The donuts is to enjoy life. Death and dying are non-negotiable. That's going to happen earlier or later. We can't do anything about that. We can prepare for it. But the donut is to make sure you're enjoying life. I enjoy donuts. I enjoy, a good old donut with a cup of coffee is what I enjoy.
Yeah.
And we have to make time to enjoy something every day. Make this life, however long or short it is, count, and be an adventure, be fun. And it's more about living life. People exist sometimes at the end of their life.
Yeah.
But we have to enjoy our life because it passes quickly.
So true.
Yeah.
I'll get more into that, I think, towards the end. But I'm interested, how did you first get into oncology? What was it that made you think that's what I want to do?
Well, my year in United Kingdom in Hull, I enjoyed working with the cancer patients. They're really extraordinary people. They're on they use the word battle for cancer. I don't really like the word. But they're people that are on this journey and they're trying to figure out how to get better, and they don't always get better, and they thankful patients. They are keen they work with you, and oncology is a journey with people. I think that's what I enjoyed, is you walk with them for a long period of time. Sometimes their road ends, but you have this long journey with them. It's not like emergency medicine where you see a person 5 minutes and then it's gone. We don't always fix things. And I think it's a combination of medicine, caring for people, and great results with treatment. Our treatments with radiation are effective. We cure a lot of people. And the technology of radiation has always fascinated me, that this light beam can cure cancer.
Yeah. It is incredible, really, when you think of all the treatments that are available now and the progress we've made in cancer development over the years. How have you seen that progress in 20 years? So I'm guessing 20 years ago, if you got diagnosed with cancer, the prognosis was a lot more severe than perhaps today.
There have been huge developments in the medical oncology field with immunotherapies. 5 years ago, 10 years ago, if you had stage 4 lung cancer, you had 6 months survival, maybe a year, and now people are getting out 2-3 years. But that's a different part of oncology that I don't work with.
Yeah.
Radiation oncology has come from drawing fields, on X-ray films where you want to treat people with radiotherapy and big chunks of radiation, to very sophisticated treatment, to very small targeted areas. We can track people's movement. We can, in a sense, pinpoint on a moving target where the radiation is to go and give bigger doses of radiotherapy than we ever thought possible to get rid of cancer. So the technology has become computerized. It's far more technical and complicated, but we're achieving great results with it.
Well, because doesn't radiation actually cause cancer as well?
It does.
Isn't it funny you can use it to cure it?
Yeah. Well, people are afraid of radiation. I say it's like water. Too much water is going to kill you and too little water is going to kill you. You need the right amount. Yeah. And with radiation, if you have too much, it's dangerous. But people already with cancer, they've already failed the cancer test. So we want to get rid of the cancer. We can deal with the secondary cancers, and they take, if they ever happen, the risk is very low. Yeah. And it takes at least 10 years for that to become a problem. So it's, in essence, like any dosage of any drug. Radiation should be thought of as a drug, and it's, if prescribed correctly and given correctly, it's safe. Yeah. But it does have some horrible consequences for people. Absolutely. The side effects are cruel.
What are some of the side effects?
Well, people with throat cancers, for example, get terrible burning and sore mouths and dry mouths and dental problems. But that's still better than being dead.
Yeah, absolutely.
You've got time to still eat donuts.
Yeah. So how do you feel like a person handles, I mean, I'm sure it's different for everybody, but how they handle a cancer diagnosis?
It depends on their background, personality, how they've handled everything in life. So, back at schools are wonderful places where we learn coping mechanisms, and a person will stub their toe, and to one person will be nothing at all, and the other person will be dial 000, get the emergency, and it's personality based. Each person will react to their diagnosis differently. Some people are very resilient, some people are stoic, some people fall apart completely. Yeah. And what's been good with about my career is that I've been able to walk with each of these groups of people to say, look, this is a journey, let's see how it goes. We don't have control of the destiny, but we can walk with you and help you along the way. And that's been I've enjoyed about my career, is that we can care
I'm
for
sure
people.
Coming across a doctor like you that holds out hope for people is just so comforting for anyone walking that journey.
Yeah. The cancer is people are terrified of cancer. It's a frightening disease.
Yeah.
And, I've seen my role as not, well, obviously we want to cure cancer. That's the important part of the treatment. But really it's to get to the next base, first base, second base. Let's just get to the next base, and then we go to third base, and we get home run and we win. But it's really those short little steps saying, let's take the next 3-month step. And then, cancer, when you see it, it's like this huge mountain in front of you. But if you're driving away from it, after 200 kilometers, it's just a tiny little dot in the back of your rearview mirror and you don't see it anymore. I have the ability to say, look, I've treated lots of people and I know that's going to happen, is that this enormous mountain that you think you can never get away from eventually will disappear. You'll cross over the next hill and it'll be gone. That takes time, and I think it's important to give people that hope to say, we treat the cancer and with the hope we're going to get away from the cancer. It doesn't happen for everyone. And for some people, the cancers don't go away, they don't stay away, they come back. But that's part of the normality of being a biological being.
Yes.
We have a shelf life. Yeah.
Yes. And so when somebody realises that the cancer is then terminal, at what point would you then say, okay, it's time for you to make preparations?
That's a really difficult question, because the thought of terminal is very broad. I had a patient who was an elderly lady, and she had incurable cancer. Let's call it incurable cancer. And I said to her daughter who was with her, and I said, we need to refer you to palliative care, because the specialist looking after the body when it's no longer working, when all systems are failing. And the daughter was so angry with me. She thought I meant that her mum was terminal and was going to die. And how can you just say that? How can you just say my mum's got to go for terminal care? And I think the way to think about it is like pregnancy. When a girl becomes pregnant, there's a 9-month wait before the baby's born. But you wouldn't go and see the obstetrician 2 minutes, before the baby's born. You see the obstetrician way upstream, because you can put things in place and get things ready for eventually when the baby's going to be born and everything's ready then. And incurable cancer is much the same. We know that there's not going to be a cure outside of miracle. And it's important at that point to say, well, we know that in 6 months, 9 months, 2 years, whatever, that life's going to end, possibly due to this cancer. What do we need to do along the way so when that day comes, everything is as good as it can be, bearing in mind that it may not be great, but as good as it can be. And we get stuck in the cancer thing, but that's a step even further back, is to say in life, we know that at some point our lives, all of us, are going to come to an end. We need to be prepared for that day when our life comes to an end, but then live all the other days as if they aren't. And there's a great Peanuts and Snoopy meme where it says, one day we have to die, and he says, that's just one day. The rest of the time we get to live. And I think that's
so
the
good.
donut message, is to say, well, okay, whether our lives end in 5 years or 10 years or 150 years, imagine if we lived to 150 years. At some point it ends. Let's do the best we can and be ready for that day. But what can we fill our life up with? I can think of, donuts and holidays and adventures. Let's do all of that while we can. And one of the things we get, I've seen it in my work, I've seen it in my patients, is get caught on this little hamster wheel of busyness and work and activity. And, we work, and we don't really stop to get off and say, the proverbial smell the roses, stop to smell the roses.
We've had a previous guest here, Luke, and he has the world's rarest cancer. A sarcoma in his brain, I think it was. And he was given, I think, 12 months to live. And he was about 27 at the time. He's now 7 years post that. And he went down a very holistic kind of track. But it's interesting because in interviewing him, his mentality was very different in terms of not necessarily looking to the future, but really loving and embracing today and being thankful that he's got today. And that seemed to have kept him going to the next day and the next day. And so there is this element from his story anyway of hopefulness and positivity against a really terrible diagnosis and prognosis. So where does hope play in that journey?
Hope is essential. You need to give people hope not false hope, not make false promises and say, look, everything's going to be great, you're going to live forever. But you've got to say, look, let's get to the next base. We can get there. We can take the next step. Let's enjoy what we're doing. And often that will to live is important. We don't understand all the aspects of health. As a doctor and a scientist, I have a view of health. The holistic and other parts are also important. There's definitely a spiritual component. There's an emotional component. There's a greater understanding of health that we don't see the full picture. But the thing for an individual is to say, how can I make the best of my day? And I think if we can get that going, that's why I picked something like a donut that's easy to achieve. We don't have to go visit the Taj Mahal or climb Mount Everest. But if there's something you enjoy in a day, cup of tea, listening to music, we can achieve that even on a bad day. We can have 2 minutes of good time, 2 minutes of own time, and really need to prepare for that and say, this is important to make my day count.
Yeah.
Because sometimes things are terrible for people. They've got medical appointments, they feel unwell, treatments are making them unwell, they fill the eyeballs with drugs, but find time to enjoy something. Yeah.
Really, mindset is so important, isn't it, on any journey, not just a cancer journey, but any journey that we're on. Having a positive mindset in a bad circumstance really can help us through. Have you seen dramatic changes for people that have maybe been more positive towards their diagnosis?
I say to my patients, you have a choice when you have terminal diagnosis. You can either get on with living or you can get on with dying. So they have they can go down the route of everything's bad, I'm dying, and it's a downward spiral, or what can I do to keep living? The most difficult thing we have, I found, is the concept of denial, people that refuse to look and face the reality of their circumstances. Yeah. And in the medical teaching about the phases of grief is to say denial is acceptable. And I guess in a way, if people want to live in denial and pretend that death's never going to happen, in the sense for them as individuals, that's fine. But dying never affects just one person. There's always someone else involved. There's a child or a husband or a wife or a carer. It's a dyer. There's usually two people involved in this dying journey. And for the other person who's involved in the dying journey that's not dying, it's as traumatic, it's as bad, it's as awful, it's as much loss. And if you live in denial, you disregard that other person completely. You don't include them. So if I can change one thing, is to say to people, you need to move on from denial. It's fine to look away from death for a short period, but you have to face death, not just for your own sake, but for the sake of the person who's doing the journey with you.
Colin, in your book, you have a comparison between two of your patients. Yeah. And one was, can you tell us about that? The two I'm talking about?
Yeah, I was a junior doctor, and on the ward at the same time I had one lady who had obviously made peace with death. She had an expectation of heaven. She had lived a good life. A husband loved her. And I'd walk into a room and there would be, in the sense that she's dying, still a happiness and I think a light that she'd still shone in terms of who she was, what sort of person she was. And on the ward at the same time, there was another person who was terrified of dying. And it was such a contrast. They're both going to die, but the one was completely at peace and happy with it, and the other person was fighting this battle to stay alive. And I'm all for fighting to stay alive, but there's a point where you've got to stop fighting and say, I realize that my life is coming to an end. I need a different strategy to manage this. And I guess that's the conversation, is to say, well, when we don't know when this conversation is, do we have this conversation a week before people die? It's too late. There are too many things going on. So the conversation of death and dying, are two people involved. The person dying may say, I don't care. My life's ending. I don't want to know about it. But the person with him, that carer, they need to know a lot about it. So in terms of how important was this for us with death and dying? Because my interest was there. I'd seen people die. I realized there's a need with Tom that his life was ending and nobody had spoken to him, and his life ended within those 2 weeks and there was no preparation. The saddest deaths are the ones where people leave home in the morning and they don't come home at night. There's those leave people traumatized for a long period of time. Yeah. So how can we prepare people for dying? So too close to death, they they cannot manage that. So how far back do you need to have these conversations? I don't really know. But I think if we can just start having a conversation about death and saying, look, this is a normal part of life. If we can say it's normal, then you've already won. You've already.
So is this the purpose of your book, to get people to engage in those conversations at the right time?
It is. It's to say, look, let's talk about death as something that's normal, going to happen at some point in my life. When we get to the point where death becomes important, this is what we can expect. But we're not there yet. Let's enjoy life. And then if that process is coming closer for both the carer and the person dying, coming back, I did research and said, look, we interviewed a group of people who had bereavement and said, how were you prepared for death? What information or education were you given? You knew that there was a terminal diagnosis. How were you prepared for death? And apart from one person out of, I think we interviewed 12 people, one person was prepared. They had an amazing palliative care doctor. The rest had no idea. They had absolutely no idea what was coming, what to expect, how to manage it. And we as clinicians and health professionals hold the knowledge, but the people going on the journey were just really abandoned to a lack of knowledge. And it was costly for them. They made wrong decisions. They made expensive health decisions. You know, if your life is ending, going to a clinic in Germany is not going to make you live longer. Having extra surgery is not going to make you live longer. There's a point where you turn the corner and your life's going to end. And that needs a different approach than saying we've gone from saving lives to being at peace about the fact that my life is ending.
So you say there's a lack of knowledge for carers, and those that are sick.
Yeah.
Do you feel that there's a responsibility on clinicians to say, hey, you're at that point now where you really need to be considering these things?
It's very clinical because we can say clinically, your life's ending, you've got limited time to live. That's a clinical discussion which ends there really quickly. The journey to walk with someone and say, let's understand this, let's talk about it, and takes longer. You've got to spend a lot of time in the clinic talking to people. They really need some form of counselling.
Is there support services for that?
There are, but linking them up is difficult because people that are dying aren't always ready to. They don't want to talk about it.
Yeah.
One of the challenges we have, for example, is and part of my research went to funeral parlour or funeral house to go and find out about what happened at funerals. And it was shocking walking in there. It was so cliche, typical, death is waiting, which coffin do you want? You can get one with the golden handles.
Having to make those decisions in the midst of grief.
How do you go in there when you're like, I don't think it's easy to do that at all.
No.
Yeah.
So part of why to have these discussions is to have something that is not threatening. You can read a book, for example, in your own time, without people bugging you. You can read it in secret. You can pull it out underneath your mattress and have a quick read. And the idea is to say at your own time and your own pace is to be advised about, hey, my life's going to end at some point, hopefully in the distant future. I'm equipped for it, but now what can I get on and do?
What I like about your book is that it's the kind of book that's easy to read, which is unusual for a book on death and dying. But it's also something that I would recommend people reading while they're in the best of health. So that while they're doing well and death is not so much of a looming threat to them, they're gaining all this information because you've got practical tips, you've got legal tips, you've got how to tie up all your loose ends, but also how to make the most of your life during that time. If you know that while you're in the best of health, then when that time comes, or if that time comes for someone you love, you're already stocked up with that information. And it's kind of like you say in the book, 100 years ago, death was all around people. Like it was part of society. Like someone would die and the body would be in the house for people to view, and it was just part of life. Whereas now we do sweep it under the carpet. We try and hide it away, don't we? So that we don't see death. It's too confronting. But if it's normal part of conversation, and I know you've mentioned before, try bringing it up at the dinner table.
Have you tried?
Yes. Well, we have with your book, discussing your book around the dinner table. And it is actually very interesting, and I think it draws out conversations of people's, I guess, near-death experiences or their experience of someone they knew who died and how that looked for them. For me personally, had a car accident in 2011, which confronted me with death. But that was a real turning point of my life to realize that I could die at any minute. That accident was so fast that I realized death can be that fast. And that really changed my thinking to making the absolute most of every single day, because it could just happen in the turn of a moment. So I think reading your book was refreshing in a way. It sounds weird, but it just, I felt like I was tooled up, if you know what I mean, to when that time comes for anyone around me or for myself, I feel like I've already got those tools on board. If that makes sense.
I think it's an important point that you raise, is that when we think of death, we do kind of push it to the back. Oh no, I don't want to think about that. It's too painful to think about that. But actually to be conscious of it in any stage of our life, because when we've got a business plan, we're planning the next 5 years and we're working towards what we can see in 5 or 10 years' time. Well, really, we should be working towards, that's inevitable. We're all going to get to that stage at some point in our life and actually plan that we've achieved everything that we want. While we're still healthy, while we're still alive, let's achieve those things we want. Let's do those things. Let's not kind of wait until sort of we're unable to do them. Let's see if we can accomplish things now. I think it gives you that sense of living well and enjoying life, eating donuts.
Yeah, love the donuts. The thing that I guess in terms of speaking about death is, if I could leave one message, is to say it depends what happens at the end of this life. If it's curtains are drawn, end of the show, lights go off, that's a tragedy. I do believe that death is not the end, it's a doorway. And if I can get people to think what happens when you go through the doorway, it creates a whole lot of opportunity. If you don't really end when your body ends, what does that mean?
Tell us about that.
Yeah. So that's an exciting thing, because we have attachments. I want to see my grandparents again. I want to see my wife again. I want to see my kids again. What if death is not show over, end of the road? What happens if we go through this door? What's on the other end of the door? That's I don't want to give away all the secrets about what I believe, but if that's an opportunity for people, it must create hope. And it comes back to your question of hope. There must be hope that I continue. And we've got all the religions to look at. All the religions essentially say at the end of this life, there's another part of life. There's an accountability. There's something after this life. They all do.
And you hear lots of stories of people, when they're at that point of death, it's almost like their eyes are looking towards the next phase. I hear that so often, or there's a knowing right before they pass that they are transitioning.
They're losing this world is disappearing and they're going into another dimension. So, there's science you can look at. Science is difficult, but there's stories and myths and religion. But the fascinating stories are near-death experiences. People that have died, whose lives have ended, and they say, my life ended and I went to be with God, or I went to, this is the experience I had. And that's got to create a whole lot of, that gives hope. That's a great news story in terms of saying when this life ends, it doesn't end. I keep going. Dr. Mary Neal, orthopedic surgeon, wrote her book. I think it was, I forgot the name of the book, but she had a near-death experience, drowned, and had experience of going to be with God, and said her time wasn't there and came back. George Foreman, the heavyweight boxer, the grill guy, he had a near-death experience. He died, but he had experience of going to hell. He had a negative experience and came back from there and said, I'm going to change the way I live my life. But these are things that I can argue against religion and I can argue against philosophy, but it's difficult to argue against a person's experience. So was it just their brain fizzing out? But it makes it interesting. And putting it all together, there's another chapter. When this book finishes, there's another book that starts. And we get to read the end of this book to say, I might be on chapter 13 of a 80-chapter book. And chapter 14, my kids are chapter 12, and chapter 13 is my education, etc. Eventually, we can get to write the rest of our book, and we can also try and imagine how we finish our life. this is how I'd like my life to end, is in hospital, eating donuts, whatever. But when this book's finished, the next adventure begins, and how do we make that? What's the hope in that? That's a great hope.
And I like the idea of bringing that question to the forefront.
Yeah.
What is after this life?
Yeah.
Because perhaps we go through life and we never actually consider that, and we get to the point of death, and maybe it's suddenly, I don't know what I believe about that, or I haven't educated myself enough, or discovered things for myself. To actually have that in the forefront of our mind as we go through life, I think it's a really important thing, because then that means we won't fear death if we know that's only a transition into what's beyond that.
Yeah. So that's 100%. That's the thing, is if we know if I'm going to be safe in death, if I go through this door, my body stops working, which I know it's going to happen. It's that business planning thing. I know that in the future this is going to happen. When that day arrives, my body will be left behind, and I will go through the door to what? And, I think there's a great expectation. You can have a great story there.
There's been a lot of research for people that are at that point of death, where perspective suddenly changes, and the things that maybe they held valuable throughout their life changes at that point. And they see what was really valuable in their life, or some of the regrets. Have you experienced people at that stage, and what is their perceptions?
There's some people that change. There's some people that realise their life's ending, and they have this opportunity to refocus, think what's going on. Being at the chairman of the board's no longer important. Other things are important. Grandkids, the family stuff, the love stuff, that becomes important. But in terms of some belief structures, they're just entrenched. People, even at the end of their life, you'd think they would say, in terms of this door concept, is there something beyond the door? And they'll refuse. They say there's nothing, life ends. And that's a frustration, is he has all the evidence. There's evidence in religion. There's evidence in myths and traditions. There's evidence in near-death experiences. Why would you not consider it? And some people will not. They entrenched and say, I won't. That's what I believe. And that's a bit of a sad thing. But the hope is, one of my friends, she had a friend who had a terminal diagnosis. She gave him the book to read, and he read the book, and it went from a discussion of my life's ending to, I should give up, maybe even voluntary assisted dying, whatever. And he read the book, and she had a chat to him and said, how did you find the book? And he said, I found it really interesting. I didn't like the spirituality in there much. And she said, why not? And he couldn't answer. He couldn't say, there wasn't a reason. It was just one of these walls that had been built up. I'm not a spiritual person. And she said, well, why not? And she gave him another book to read, and it was C.S. Lewis's book, Mere Christianity. Yeah. And he read that book, which is you got to chew on that book. But it appealed to his mind, his intellect. And he read through the book, and we don't know what happened at the time of death, but there'd been a change in his anxiety and his stress. He died peacefully, in a sense. And I think that's the hope, is to say, I'm going to reject this door. I'm not going to go through it. I don't believe it till you yield to it and say, I accept there's a door, and I accept on the other end of the door there's something good for me. It's a narrow door. You can't take anything through with you. We come into the world with nothing, and we leave with nothing. You can't take your bank balance with you. You can't take your Porsche with you. You can't take your doctorate with, or your titles with. It's a tight squeeze through there. And I think part of it is you've got to be willing to let go. You've got to be willing to go through the door, just you and skin alone.
Wow. Yeah. That's so good.
Yeah.
So have you got some
definitely. I really, really love what your book is about, because it's really tooling people up at probably the most important season of their life, transitioning to death, to really do that well. And I don't know of many resources out there, or many people out there, that are actually offering that kind of information, and how valuable that would be for people in that most painful time of their life to have that. You've took the thinking out of that for them. But the gold that I see in you is this sense of hope that you have, and I'm sure that transitions to your patients, but to share that hope. And it's not an unrealistic hope. It's a hope that's genuine, that's, yes, you're in this stage now, death is inevitable.
Yeah.
But there's still hope that something good is beyond that. And I don't know how you're able to share that, or whether you can ever talk about that with patients, but I think that it just comes off you. And we all carry a presence about us, don't we? And so that comes off you, and I'm sure translates to your patients so that they feel safe and comfortable in your care.
That's so good, Ange.
Yeah.
Yeah, you've nailed it. And the only thing I would add to that is that he's gone above and beyond his role as a doctor to find this out for patients and to reveal that and give that education where there was none. So, thank you, Colin, for sharing this story with us.
Thank you.
That's a great pleasure. And thank you for helping me get the book done, because, it was a clunky, chunky thing that was dumped on your desk, and we managed to get something really good out of it.
Oh, it's a pleasure.
Yeah, I was going to say, I assume Beck published your book.
I absolutely love it. There it is there.
Death, Dying and Donuts, it's called, by Dr. Colin Dicks. And that's out now, is it?
It is.
Yes,
and how can somebody...
You can purchase that through any good online bookstore, or you can go to Colin's website.
Yeah, Death, Dying and Donuts website. It's there as well.
Okay.
Yes.
And
you also have a charity.
I have a charity, a non-for-profit, which is to promote death education, is to get people to look at death in a safe way and say we have information about it. So that's being revamped and redone.
And what's that called?
That's called Dying to Understand. Yeah.
Beautiful. I love that. And I think this book, you don't have to be in that stage of life to purchase this book.
No.
I think if it's something everybody should be resourced with.
The sooner the better.
Yes.
That's it. Yeah. Take it on board with you, I think.
Yeah.
For sure. Thank you
Thank you for joining us.
Thank
you
you
for
much.
sharing your story. That was fascinating.
So, Ange, how'd you find that interview on Death, Dying and Donuts?
It's confronting, isn't it? Like the thought of death. It's not a conversation we have very often, except when perhaps it's directly impacting you or a family member. And what I love is the fact that he's saying, no, don't wait till that moment.
Yeah.
Actually have those conversations now.
Yeah.
Because we should put it in as part of our plan so that we reach that time of our life, which is inevitable for all of us.
Yeah.
And we can't avoid it. So
Yeah.
why don't we just talk about it and
That's
plan
right.
for it so that we can do that part well and make sure when we die, we've done everything we can for those that we leave behind. I just love the thought of doing that and making sure we transition really well.
Yeah, that's right. And it's not even just for people who are dying. It's actually for those who have loved ones or people they know who might be dying or being diagnosed with a terminal illness. It gives them tools as well on how to care for their loved ones during that time. I think like death is something that no one wants to think about really, but I think we feel more equipped when we do have this education on board, don't we?
Yeah, and I think for a man that's spent 20 years around dying people, people that are dying every day around him, but he's just got this lovely kind of lightness around it, like he's not like he's carrying a heavy weight and he's still holds out a lot of hope. And the fact that, for him it seems like an everyday thought of what the afterlife is like. And that gives you hope that when you are surrounded by death, that there is something beyond that. And I really loved his sense of hope, and he called it spirituality, that is a component of this part of our life. And no matter what our beliefs are, we have a spiritual element to our life that needs to be considered.
That's right. And it's great to have the conversation, isn't it?
Yeah.
I think like we were talking about, sitting around the dinner table talking about these things is really important, just to get people speaking about it, thinking about it, discussing
normalising it.
Yeah, normalising it.
I like the way that he just did that. He just talks about it because it is part of his everyday.
Yeah,
and
that's
so
right.
it is completely normal for him to have those conversations. But for your average person that's not around that, it's not a normal conversation. But we should make it so.
That's right.
So it's not such a mysterious thing that happens at the end of our life.
It's not scary when you're prepared, is it?
Yeah, that's right.
Yeah. No, it was great. It was such a great
thanks for bringing him in.
conversation.
He was so good.
Yeah, pleasure. Yeah, the book's great too. So
Go and Go out and buy it and
Yeah.
resource yourself, equip yourself, and educate yourself on what's inevitable for all of us. So that's it for today's podcast. You'll find us on all the major podcast platforms. The podcasts come out every Wednesday. We'd love to hear from you on our socials, the Gold Diggers Podcast. Tell us about your story so we can find the gold in you.
Easy as pie, lemon, apple or cherry. Loving you is so very sweet, sweet, sweet. How can it be such a piece of cake? And your smile is the icing. Loving you is a party. Honey, you're my sugar.